morning everyone. My heartiest welcome to all the esteemed panelists for today's discussion. So today we are going to explore the social intersection of research and development, innovation and infrastructure. So to start with, I'd like to request our chair of the session, Dr. Jitendra Sharma sir, for his quick opening remarks on the topic, sir, and then we will discuss the results. Over to you, sir.
Good morning, everyone. Thank you. All those of you who are not listening to this session, please understand that our friend Afzal will be putting a billing counter before lunch. And those of you who are listening to this session, the food is free. Along with the food, our lecture is also free. Our promise is to make this session very, very boring for you. So boring that you enjoy your lunch. Help us do that. Thank you to MedTech and the organizers for bringing all of us together. It is a very nice family gathering. This morning, I received, and many of you would have received Mr. Rajiv Nath's message. It is to celebrate, congregate, and confer. This is to converge and congregate as a family. Trust me, as you saw the presentation that Mr. Nath gave, some of the talks that some of the points Mr. Gaurav Agarwal mentioned, these are points to make our family of MedTech stronger in the country. I have been in this sector, privileged to have been in this sector for quite some time now. I am going to share some things which will make our family stronger from inside. Firstly, all of you know AMTZ. AMTZ is the first medical devices cluster in the country. It is also, I can also use that mic. It is also the proof of concept that medical technology as a group can be stronger than individuals, us separately elsewhere in the country. Because we thrive as a group. AMTZ today is the only cluster in the world, and it's a matter of great pride because in 2015, in August 2015, the DOP presentation here, which Mr. Rajiv Nath mentioned in his talk, was how the sector will go forward. But if you check all the points that was discussed at that time, today you will see that in AMTZ we have tried to put together a unique concept which makes it the only cluster in the world where we make right from a mask to an MRI, from an anesthesia workstation to a cath lab, from a CT scan to an RT-PCR machine, from a biochemistry analyzer to a surgical tray. This cannot be done alone. This can be only done as a family. But here are my 3-4 pointers to IMED and to our industry colleagues that we need to look into these pointers quite quickly. Pointer number 1 is our huge dependency on raw materials. We all know that there is a chip shortage in the world. We all know that India does not produce yet a large number of sensors, whether it is MEMS-based or electrochemical sensors or oxygen sensors. We do not make sufficient sensors. I will give you a small story. You know, all those people among you who deal with orthopedic implants, the lining of orthopedic implants is made by a material called ultra-high molecular weight polyethylene, UHMWP. For the last 38 years, Indian orthopedic implant manufacturers used to import this raw material, which is the lining of the implant, from 2 countries in the world. What we did, we got together with the Indian Implant Orthopedic Association. We took the samples they used to get. We found a raw material supplier in Derabassi village in Punjab. We modified that raw material using some infrastructure that was supported by the Department of Biotechnology in AMTZ, and I also see our good friend Dr. Sonia here. We use this infrastructure to modify the raw material to make it 6-bar compatible. We set up a RAM extrusion facility to produce the raw material, and we signed an MOU with Indian Orthopedic Implant Manufacturing Association to take that raw material. Today, we are the only third entity in the world and the only one in India to supply all that raw material to entire Implant Orthopedic Industry Association in the country. A material which was imported for 38 years, today we are able to produce. My suggestion is, as we look into more and more MedTech, let us also look into more and more of raw materials, because if we are able to make raw materials, we will be able to make MedTech. Whether it is analyzers, photodiodes that we use in diagnostic analyzer, our friend from Moriba, he would know, large number of products require components, and as industry, as a family, we have to quickly gather the know-how of these components and producibility. My second pointer is what Mr. Rajiv Nath mentioned, and I'm mentioning his name only because the pointers that he deals with are ethical and transparent. He used the word responsible manufacturing. I want to tell the industry association, particularly IMED, that we need to quickly look at responsible manufacturing. During COVID, and I have the data and evidence, some manufacturers who saw medical technology quite lucrative jumped in, they made money, and now they want to vanish up into thin air, or put money in baggage scanner, or put money in air cargo and things like that. This is not responsible manufacturing. So I would like IMED to request all its members to not let go of responsible manufacturing component. We at least know, because see, this sector is made by champions. This sector is made by companies like HMD and Nerula and Allied, many here who have given their blood and sweat for generations. And they have stood for brand India and good quality products everywhere in the country and the world. Now, manufacturers who come in as fly-by-night operators for a few months to take advantage of COVID wave, make money and vanish, they leave the sector crumbled. They give you feedbacks even within industry association which are not sustainable, not ethical and not transparent. And when they vanish back, you won't even find them again in your lifetime because they won't exist in this sector. So any feedback such members give you, be vigilant and use your mentorship and leadership to guide them towards sustainable, responsible manufacturing. My third pointer is, you would be happy to know that in AMTC in Vizag, we are now making a hospital called Made in India Hospital. This hospital is the first hospital ever made in India which will be using only Made in India medical devices. Whether it is syringes, or it is gloves, or it is MRI, or it is cath lab, or it is cardiac stents, or it is analyzers, this hospital is a proof of concept what we can achieve together. Because in expos, like Dusseldorf in Medica in Dusseldorf or Arabel in Dubai, we take a booth. One manufacturer says, I make this, and the surgeon comes and says, well, do you make that? And then we say, no, go to the next booth. We thought how wonderful it would be if we can create an entire hospital which uses only Made in India medical products and gives this proof of concept to the world. And this is only a beginning because this is a G20 project along with Australia. If this goes well, which I am sure with all your support it will, Made in India hospitals would be there in at least 16 countries of the world, where not just the hospital, entire medical technology value chain would be originating from this country. And then I just want to invite you all. We are very honored that from the 10th to 13th of November, The International Clinical Engineering Congress has selected India as the venue. Previously, this was held in Rome, and before that in US, and before that in China. This is the first time we will be bringing together about 2,000 industry players, which constitutes the Global Clinical Engineering Alliance into India at Kalam Convention Center in Vizag. That is 10th to 13th of November. And from the 14th to 16th of November, we have the first World Health Organization Health Innovation Forum, which will bring together 194 countries to talk of health innovation. So this 1 week of MedTech festivity, from the 10th to the 16th of November, feel free to write to us, go on to the website of WHO headquarters, go on to the website of Clinical Engineering Alliance, and be part of it to show the world what we can do as a family and how we can expand this family globally. It is also not just about India. There are 34 countries in the world which do not have a single linear accelerator for cancer care. Don't they have cancer patients? It is not just about India. If you look at the logo of G20, it is one world, one family. And therefore, as a family in India, the MedTech in India, we need to expand and make this world our family. We need to reach those people who don't yet have access to MedTech, advanced MedTech, life-saving MedTech. And to that extent, whether it is our regulator, Dr. Ravikant Sharma ji, or our doyens of industry like Dr. Mr. Anjan Bose, we call him Anjan Da. You know, in Bengali, Da means elder brother. You talk to anybody in this room, they will call that man Anjan Da, not Anjan Bose. That is the bond this industry has built. This is not the bond you will find in many countries in the world. And therefore, my request is, let us make this bond stronger by evidence-based improvisation, not assumption-based, evidence-based. Let us make this family stronger through our niche development of raw materials and components. And most importantly, let us make this family stronger by encouraging responsible manufacturing, which is long-lasting and committed for decades and generations. So with that, I think we have a brilliant panel under Mr. Ravikant Sharma and our wonderful industry friends. Thank you for being here and looking forward to seeing you all in Vizag for the Global Health Innovation Forum. Thank you.
Delegates on the dais, representatives from the industry, representatives from other departments, ladies and gentlemen, very, very good afternoon to all of you. At the outset, I like to thank the organizers to invite me to have deliberation on this innovation of the medical devices. Friends, we are talking today that we have market size of medical devices 11 billion US dollar. And over the next 5 years, we are thinking our objective is to increase 50 billion US dollar. How can we do that? How can we reduce the import and we can increase export from our India? I like to touch upon 4-5 points for this in this regard. We have to become the self-reliant, self-sufficient and self-independent. How? The first and foremost is the clear regulation, understandable regulation, transparent regulation. If you remember, we started the regulation of medical devices way back in 2005. And we started only 10 medical devices like cardiac stent, orthopedic implants, catheters, cannula, etc. And these were regulated as a drug. We were not having at that time what are the regulations, what are the rules for medical devices. We were asking the GMP in place of quality management system. We were asking the toxicity study in place of the biocompatibility. And we took 12 years to make out the medical device from 2005 to 2017. With a series of the deliberations with the stakeholders, we have now a set of book set of rules and which are implemented, which are enforced for the regulation of medical devices. Now the question is, we have the rules. How can we regulate all the medical devices? Because we were regulating only 10 medical devices. Then we notified 4 more medical devices like nebulizer, glucometer, thermometer. Again we notified 8 medical devices like ultrasound, MRI machine, defibrillator, etc. But there are more than 6,000 medical devices. It is not easy to regulate all. So Ministry of Health and Family Welfare contemplated and come out a notification and defined the medical device definition. So the products which attracts the definition, they will be under regulation. But overnight, you cannot regulate all the medical devices. That's why we make out a roadmap and we have given the adequate time period for the manufacturer. We have given 30 months for Class A and Class B medical device regulation and 42 months for Class A and Class B. Now, at this point of time, all the Class A and Class B medical devices are under regulation, and rest of the Class C and Class D will be under regulation from 1st of October 2020. So now you can see the change from within the 5 years. All medical devices will be under regulation. Today, we are receiving all application MD online portal digitally. There is a timeline defined in our medical device tool. We have notified more than 236 medical device officers, so that the regulation can be implemented in a frequent manner. So this is the regulation part. Second is the innovation. Friends, our disease burden is characterized by various diseases like cardiovascular, like diabetes, and we call that the capital of the diabetes, world of the diabetes. Why? We need to have the good quality of the products for the early diagnosis of the medical device. The good quality of the product. So innovation is very, very important. All the manufacturer, importers, they should come forward with the startup. They should have the agreement and collaboration with the research institutions like IITs, like CSIR, so that the good quality of the products can be built, which will be available not to our patients, but across the globe. So innovation is a very, very important. Third is the quality of the product. We have the Bureau of Indian Standards who are formulating the standards, and Bureau of Indian Standards has drafted more than 1400 standards for the medical devices. For the quality, we have registered more than 30 laboratories, those who can test the medical devices which are imported and manufactured in our country. And fourth is the availability, accessibility, and the affordability. Friends, we have vaccinated more than 1.3 billion of people. That was not an easy task. Was there any issue regarding the shortage of needles and syringes? No. Smoothly that was gone up. So if there is a problem for the Nipah virus, for the malaria, the diagnostic kit should be made available to each and every patient of the country. So availability, affordability, and accessibility is very, very important. And lastly, but not the least, vigilance reporting. All the manufacturers are sitting here. If you have any problem, the quality issue, you should intimate to the licensing authority immediately, so that the root cause of analysis and corrective and preventive action can take place in time, and we can withdraw and we can recall the products which is substandard quality. So thank you very much for once again for giving me this opportunity. Thank you.
For highlighting the important criteria and the tireless work done by the CDSU. You have rightly mentioned the clear and transparent regulation, innovation, quality, availability and accessibility, and pharmacovigilance. Those are the prime importance areas. Now moving ahead with the industry. So in the recent years, we have India has witnessed a significant growth in the MedTech sector, but there are still some challenges that needs to be addressed to further promote the R&D and innovation in the industry. In fact, the government has also recognized the importance of this sector, and there is a focused provision for the to support the R&D and innovation in the National Medical Device Policy 2023. So my ask for Dr. Rajiv Gautam. Dr. Rajiv Gautam is the President India Business at Horiba India Limited. Dr. Rajiv, from your perspective, what are the key challenges faced by the industry in terms of R&D, innovation and infra? And how do you envision the collaboration between the industry and the government to address these challenges and further promote the R&D infra and innovation in the sector? What specific actions or initiatives can be undertaken to foster this collaboration? Over to you, sir. I hope it's not a big question. Thanks.
Thanks, Ravi. I think it's more of willpower from the vaccines. Ravi, 2 points. This is like 2 points in R&D innovation for India. 1, academia industry partnership. We are here mostly the industry perspective. Myself, from my activities, so I don't know. I know how the technology, the students are developing there, but it's remained on the PhD thesis, it's remained only on the shelf. There is the US is a different country where I think most things can come to the industry. In India, it's very far ahead. I think somewhere India has to use the technology which we have with a lot of academic institutions. IIT Kanpur, I do the semiconductor institution. They are starting a new course of semiconductor. Everybody knows that we are short of semiconductor, and in India was not semiconductors now. The first manufacturing data is investing 90 billion in the next 5 years in the first manufacturing. But we are the people. Ultimately, manpower, we don't have the manpower to take care of the manufacturing and all other things. And for immediately also want to make a 50 billion in the industry. But I don't know how many people are, how many manpower, training power we have. So we should have this many IITs we have. Everybody is 10 years for different how they want to complete this. So industry, academic partnership. This starts at those states, diplomas, various states, various IITs, other lot of others in the industry, LCD, they have gone to that here on all this. That's the first point. The second point, the product design cost. Still, there is a lot of cost goes into the product design somewhere the capability of the designing situations and the depends on this country, we have to reduce the cost of the product. If imported product is still by 10%, 5% in the range of manufacturing product, is over imported product, which is industry not good. 2 points, manpower, skilled manpower, and the product design cost reduction are one of the key items that are in
Thank you so much. And into the patient outcome. So we have with us Dr. Sachin, he is the head of artificial intelligence at Sony Research. So as Dr. Sachin, you are actively involved in developing the AI-based solutions in Sony. So based on your expertise, what specific recommendations or suggestions you have for the policymakers, the industry leaders and all the stakeholders of this ecosystem to encourage the adoption and integration of AI in the R&D infra and innovation MedTech sector in India, and how can they create an enabling environment for AI-driven advancement in this sector? Over to you, sir.
I will come to the point which mentioned about the AI advancement. But first of all, before that, I just want to add that AI will not replace the doctors or the experts. And sometimes we see lots of events where we see that case will be hijacked or something like that. AI cannot replace the responsibility of the doctor. What I say in my words that AI can help the doctors make the treatment early diagnosis and it can help the doctors because me and my family have been platform. So we can just help the doctors to make the right treatment, the right patient, or the right person, at the right amount of time. And we also, when we interact with the doctors, like they say, if I know at what time, what level I have to start the treatment, so it's good that they can help me now. So I would just say that AI is definitely a wanted system. So coming to the policy side, that we have to be very strategic that okay, what is the expectation from the AI side, and especially now generative AI is knocking the door, and generative AI has basically a new role for the healthcare AI side, where the synthetic AI is also a possibility to do a early, I would say, experiment or some prediction, I would say. But yes, synthetic AI can also hold the issue. But it can be an early stage, I would say, physical this, I would say, and it is the doctor's opinion in the early stage. Regarding the policy making side, so definitely data should be treated well by the labs, and in that case, the ethically should be there, so that patient data definitely have to be very considering about the security of the privacy. So when I recommend, even when we also take care of clinical or not to use it for I would say, and consider it as research point of view. So I would just add on to that experiment should be there under the control of the ethical guidance, and CGI will also publish the guidance and well drafted ISO guidelines. So how to deal with the data, how to treat the data, and what stage is the data to be considered. That is quite, I think, excellent way to do it out. And while drafting, I would say the slightly awareness should be also be there, whether it's an institutional, government, or hospital, that AI tests for the helping hand cannot be anything. So even I have seen that by talking to the medical doctors, let's say, he's doing the treatment for a patient, and he has to talk, let's say, 5 to 10 minutes for the emergency. But might be AI might help for the side. Everybody has a different way of explaining let's say somebody has a stomach pain, so somebody may have a different way of saying the thing, somebody may have a different words, different language. So AI can help the doctor to understand it very easily. And I'm also listening about the personalized medicine. So it's also be I would say AI is the progress of that. But yeah, it's time taking different way, and predictive, I would say, medicine or personalized medicine are the same concepts. In addition to that, also same other concepts which can help the doctors and the patients to best, I would say, the diagnosis and the treatment, and definitely the doctors, the medical experts. So coming back to the point, if we follow the coordinated system in a very structured manner and considering for the humanity and for the human benefits, and I guess has to progress phase wise, and because AI has to take time because he really was a server, CPU, etc. But yes, time will be there, and it will be part of the life because we have seen like this, like we never got a mobile phone to use for e-commerce, payment, or shopping, or so. But now what we see is a very mobile, for healthcare sector. We have seen in COVID immediately people use mobile phones as a healthcare. Soon the device will be there, but the cost of that will stay. Technical control or benefit for the patients as well. And I think AI is the helping it correct more friendly to the patient doctor, and that's what
yes, and ultimately. So actually, we have seen during the COVID times that first the patients and even doctors face a lot of challenges in terms of patient always ask that it is the feel of touch of the doctors and we speak for any doctors. But gradually, once the COVID came and we We have seen the rise of the digital healthcare in this era, right? So the 2 points we can say: the ethical consideration for the policymakers, for the guidelines for setting up the AI in the MedTech industry, for the predictive analysis and primary diagnosis. Thank you so much, sir, for your views. Moving ahead, Mr. Chitish Kumar, sir. We all know Philips is globally recognized for its contribution to the healthcare industry, especially in the development of advanced medical devices, with a strong focus on R&D, innovation, and their robust infrastructure. So India is a country with vast population and diverse healthcare needs, right? And as we strive to enhance this accessibility, affordability, and quality healthcare, it is very crucial to foster an environment that encourages the collaboration between industry partners, academia, and government as one of tangible contribution. So, considering the government's recent initiatives to promote the R&D, innovation, and new private sector, looking ahead, what do you envision for the future of R&D, infrastructure, and innovation in this sector? And what steps should be taken to ensure that there has been a sustained growth and development in this area? Over to you.
Thank you first and foremost for having me as platform today. Let me talk specifically about Philips first and then probably give you my view of how I see this industry. Some of you know that Philips is actually a pre-independence company in Asia. Started in 1930. We are just celebrating 93 years in this beautiful country. And I would say that if you look at purely from an R&D perspective, India is the largest R&D center for software development. We have close to 5,000 engineers, data scientists, doctors working at education campus in Bangalore, doing R&D for India and for the world. We have a large manufacturing footprint in Pune, where over 2,000 plus people are employed, again doing R&D and manufacturing. On the whole, out of the close to 9,000 people that are there working in India, less than 1,000 are actually on the commercial side doing sales for India. Inordinately, 90% of people that are employed in India for Philips are on the R&D side, manufacturing, really making it in India for the world. Okay, how do I see MedTech going forward? And I can take a little bit of an industry view out there. If you look at from a value creation perspective, entire healthcare, right? So healthcare would be healthcare delivery people, which is hospitals, diagnostic center, the pharmaceuticals, MedTech, insurance, everything, right? We are just about 6% of the entire value chain. Hospitals. End user in some sense of what we do. That's a reality. The reality is that whatever the MedTech devices, be it the cardiac exam, be it the sutures, be it whatever, MRI, whatever you name it, our dependence is largely on the head of the healthcare providers. Whether we like it or don't like it, that's a reality, because we are the inputs to the healthcare providers. Unfortunately, if you look at the data, the healthcare providers' profitability over the last 5 years have shrunk by 5%. Which essentially means that the healthcare providers are not in the heavy profits now. That's a reality. Why is that happening? Partially because of the cost pressures that they're facing. Inordinate amount of increase in terms of the salaries of the doctors, the start numbers are pretty expensive. If you ask any healthcare providers, they'll talk about it. And I think beyond regulation and ways we can split up LFC soon. I think the message that I will leave for the government and this forum would be we need to look back at the Ayushman And think about it from a macro level perspective. $1 billion put as a money for insurance for Ayushman Bharat by no means can cover 300 plus million that are already enrolled under that scheme. And think about it, $1 billion just can cover 300 million people under insurance. So if you really want an effective universal insurance to work, you have to start thinking what is the capital that we are putting in, what's the money that we are putting in under insurance. Because if you keep on squeezing on that side, the hospitals are not going to make money. How do we expect a flourishing industry like that? When my customer is not happy and it's not flourishing. And that's a fundamental change that I want to tell you. As I see from a talent perspective, do we have the right ingredients in India today? We are passing MedTech industry. The answer is an obvious yes. We have a huge 1.37 billion people. We have a huge talent base in terms of engineering, in terms of data science, in terms of doctors that are there. It's all there. We have the right skill set. Yes, it's there. But for us, the domestic demand, we should catapult the MedTech devices to the next level, has to come up. And government has to play a very important and effective role, especially when they make the strategy for not just being a provider but for being a payer. $1 billion in Ayushman Bharat insurance is too little to cover the kind of things that they are. So it's right from an ingredient perspective. So I think it will happen. Possibly think it will happen. These are some of the minor roadblocks that we have to start putting in and start putting up. As together, thinking as together, second. How do we make it happen? The MedTech policy took almost like 7 years to come out. We spoke about how 2015 the same group spoke about it. And it took like 7 years to really come out with the policy. Which we need to kind of reflect a little bit on that. So how does it take so much time?
Our time is for the faster implementation of that policy.
Faster implementation and also think from a macro perspective, as I said, just doing a $1 billion allocation for an insurance scheme. Now that so many people have been talking to like going even bigger or 500 million people, how does it cover?
Insurance and the value creation. Those are the
Because there's a value that spoke about in the morning, right? Responsible manufacturing. So we spoke about responsible manufacturing and we do not pay for that responsible manufacturing. We are kind of talking for two concepts as a manufacturer. And that's what I'm asking in this forum is I see not many positives for India, right from a policy perspective, to right ingredients, but who for the pudding really lies in making things happen from my experience.
absolutely. You have rightly said, making things happen at the root level. Thank you so much for your perspective on the topic. Going ahead, Mr. Vivek Tiwari, the CEO of Mahotsav, the largest B2B platform for medical supplies. So we have seen that the interoperability and standardization are two crucial aspects for B2B market for medical equipment. So which actually facilitate the uniform integration of various devices and systems and while promoting the efficiency of market. So my question is, what are your thoughts or policy to promote this interoperability and standardization within the B2B market platform for medical equipment so that we can enhance the efficiency and continue the market applications?
Thank you. Let me start with a very simple logic. There are thousands of medical devices manufacturers globally. Thousands of manufacturers doing hundreds of innovations, hundreds of new age technology to existing technology manufacturing. But where does it all converge? It all converges to one known element, and all of us have this in common, is human body. I think when we talk about human body, we cannot talk that human body cannot be interoperable. that hands cannot talk to legs, heart cannot talk to lung. So in the nutshell, when we are actually looking to get converts to a human body, I think we cannot stay away from the fact that we need to set up intra-operable standards for medical devices. When we talk about it, then there are 4 or 5 important points which we need to think about. Number 1, do we have the right standards? Do we have the right standards for medical technology leading to all treatment patterns? So we need to really think about data sharing, communication protocol. When we talk about even platforms like HL7, when we know that there is a lot of data related challenges, compliances, then why don't we have a data sharing platform which really builds a strong communication channel between manufacturers and the MedTech providers? Number 2 is about providing trainings and certifications. I think the biggest problem which we feel that medical technology manufacturers need to address is training and communication and certification, and also ensuring that buyers know about it. The biggest problem we as a platform face, because we are not the manufacturers, but we do not have common certifications, we do not have the common knowledge sharing platform. While I do not really take away the fact of commercial aspect of any medical device, but we really need to understand just on commercial fact we cannot give up the treatment protocols. Just on commercial facts we cannot give up the standards. Number 3, about aspects of building a very strong kind of industry knowledge sharing platform. I think it is important because somewhere a lot of gaps are there in terms of inter-industry knowledge sharing platform, which leads to a lot of intra-operability issues. And last but not the least, I think the open standards and also looking at research and testing is an important aspect, looking at the entire medical devices sector. That's all from my side.
For sharing the points mainly, which requires the for the interoperability and standardization. So we can get 4 points. I think the right standards for every treatment protocol, the data challenges which requires the data sharing models, the training and certifications, particularly inter-industry knowledge sharing platforms, and the open sharing. Thanks. Thank you so much, sir. We'll definitely take a note of this. We'll also request the Afzalji to take these points in the post-event report. Thank you so much, Vivekji. Moving on, Mr. Aditya Kohli, he is the Joint Managing Director of Allied Medical. Aditya, we have seen that the collaboration between the public and private sectors has proven to be a powerful force in advancing the MedTech industry. Now, combination of this resources, expertise, and funding, we can actually drive the R&D and commercialization of the innovative medical devices through PPP. Right? So my question is, considering this PPP thing, how do you envision the roadmap to encourage the PPP model in the medical devices industry so that the industry can leverage the resources, expertise, and funding for R&D and commercialization?
Thank you, Ravi. Very good afternoon to all my fellow panelists and everybody in the room. For the medical device sector and particularly for R&D to grow, the public-private partnership is entering the last role. Particularly, we have to talk from 11 million to 50 million. It is not going to happen unless we have R&D happening here. Any form of public-private partnership not only brings the strength of the public and private sector, it also looks to the weaknesses of both sectors. So I think the public-private option is going to be very vital. The government has already come up with some schemes which are basically research and development. The PLI scheme, has already led to a lot of research and development happening locally and now production is forward. Earlier it was limited to a certain sector, and now as Anjali also mentioned in the morning, it is being looked at and the sectors are being expanded to other sectors also. We have to see a lot more sectors added, a lot more products. That is going to give a lot of boost to the local research and development. One of the major bottlenecks that we face here is the non-availability of testing facilities. I think already the new medical device policy, 300 crores has been set aside for our facilities and creating testing facilities. Because whenever you develop something, it's equally important to test it out before going to a lot has been said today about responsible manufacturing. In our experience, when we develop a new product, it takes years to get that before you are ready to go to market to bring something out responsibly. Of course, COVID was a different time and different kind of challenge, but in normal times, coming out with a new product, it takes years together. It's not done in months or days. Getting a responsible product out there. That is not going to happen. For that, we need a lot of support from the public sector also, and private sector also has to take long term to achieving that. Other than that, the new medical device parks which are being created, these are also having incubation centers there, and so that is also going to help in increasing the local R&D. We need more institutes like the Internal Institute of Health and Technology, which is set up at AHP to bring these out commercially. You can develop something, but it has to be the commercial end, and you need some assistance doing that. The institute already helps you to commercialize, develop R&D, and I think going forward we will see many more similar opportunities across the country. We really have to take this forward. Thank you, everyone.
Thank you, sir. Thank you. So ultimately, we can see the National Medical Device Policy which has come up. It is on the right track, right direction, because we can see the views and everything has been mentioned in the policy. It's just the fact that faster implementation of the policy. Thank you so much, Arvind. Now back to our guest, Dr. Ravikant sir. Sir, we all understand the importance of international collaboration and harmonization in the area of regulation. So, as we navigate the complexities of an interconnected global economy, it is very vital that we come together to facilitate the seamless market access and eliminate the regulatory burdens. So, with this period, sir, I would like to request you to share your valuable insights into the international collaboration and harmonization efforts among regulators, and shed some light on how we can forge a path towards the efficient global market access and reduce the duplication of regulatory requirements.
Thank you, Ravi. Am I audible? I want to make my audience more attentive now.
Yes.
I will ask some questions. Are you ready? Everybody is, on the phone, countries, and why not medical devices? Can anybody answer? Our guests यहाँ बैठे हैं, मैं पूछ रहा हूँ कि 200 कंट्रीज में हम ड्रग्स बेचते हैं, लेकिन मेडिकल डिवाइसेस नहीं बेचते हैं. इसका क्या कारण है? What is the reason behind it? Yes, please tell me. So what did he say? We don't have clear-cut regulation for medical devices. It means the regulated items are accepted any part of our law. हमारे को फार्मेसी और वर्ड कहते हैं. क्यों कहते हैं? क्योंकि हमारी कैपेबिलिटी है. मैं आपको I will give an example. During this COVID session, we used to see the import of the equipments like pulse oximeter, like oxygen concentrator, ECG machine, but unfortunately we were not having the regulation. What the importers were doing? They were importing थैला भर के लाके चाइना से, वियतनाम से, इधर से they used to market in our country, and they were marketing to our patients. The cost was 200 and they were marketing for 2,000 rupees. That is not an ethical practice. I saw one pulse oximeter. I put my finger. My oxygen concentration saturation was 97. When I put a pencil, it was showing 98. That was the quality which we have imported and we have supplied to our patients. We talk about innovation. During the COVID, we were not having even a single manufacturer of the PPE kit. You were sitting at home and regulators were roaming around. How can we save our doctors? Because due to the COVID, the PPE kits should not allow the penetrates. Your whatever you are, spitting and all these things. It should stop the bacterial contamination. We went to various manufacturers. We went to Citra. We consulted with the Ministry of Textiles and we developed a fabric. And our manufacturers come out with the good quality of the PPE kits. And we are not marketing in India, we are exporting to the world. That is the capability of our manufacturers. We need education. We need guidance. The hurdles of the regulation should be removed. Education, the training, very, very important. Now you see how many research institutions and ITs they are developing the products and it is coming to the market for the commercial. Very few 2%. Our pilot, ICMR, DST, they are funding like anything. But why we are not able to convert this product for commercial use? The reason being, we are not interested. Lack of interest. This is the project, we have completed the project. When there is a product in the market and the predicate device is not available, there is a rules and regulation. You have to prove the safety, efficacy and performance of the product. You have to conduct the biocompatibility as per the 10990 Then you have to come for pilot investigation for the limited patients. Then you have to come for pivotal investigation and then market the product to the market. So now we have the clear-cut regulation in our country. We have the PROs, public relative officers in our department. Whosoever they want to come, they can sit together, they can have a cup of tea, and they should be aware what is the regulation. Because our scientists do not know what is the regulation. How to go about? They have invented the medical device. So these things are in place. My humble submission is that until and unless we are not having the true innovation, we cannot increase the export. We have to make the good quality of the medical devices and the products as per the market need. Because the life cycle of the medical device is very short. Today we have one model. If there is a doctor is saying no, it needs to be modified, if design has to be changed, then tomorrow you will be having that different model. Right? So life cycle is very short and the product should be made available to poorest of the people. Then there will be a win-win situation. Thank you very much.
Well, sir, during the COVID times, you have worked tirelessly, sir. We all know that with regards to the faster approval and all, as well as we also can't neglect the work done by the industry to provide the timely action for the PPEs and all that you have mentioned. So quality with innovation with quality and the accessibility are two points we can say. Thank you so much, sir, for your valuable insights. Now, before going to concluding remarks from Dr. Sharma, sir, AMVZ has gained reputation globally, we can say, as a prime MedTech park model. The Indian government has taken a lot of steps to encourage the investment and innovation in the sector. Still, we can say that is still a need to explore the establishment of dedicated innovation hubs or clusters specifically tailored for the MedTech industry, which can act as a focal point for collaboration, research and development, and for commercialization of medical devices. So, sir, I wanted to ask that what are the potential benefits of establishing such innovation hubs and clusters for medical devices, and how do they and then your
Thank you. All of you must have seen that I was absent for half an hour in the session. The reason I was absent is outside this hall. आप देखेंगे भारत बेंस की बस पार्क है और उस बस के ऊपर BSL की लेबोरेटरी बनी है। उस लेबोरेटरी में बायोकेमिस्ट्री, हेमेटोलॉजी, इलेक्ट्रोलाइट्स, RT-PCR सारे टेस्टों की मशीन्स वो पूरा BSL-3 biosafety cabinet is bus के अंदर which we have made for HMD Foundation from AFTZ for onward supply to large hospital and defense. उस बस की कीमत जो बाहर खड़ी है 1 करोड़ रुपए almost. A similar laboratory in hospital will be about 6 crore. 6 crore. अगर ये किसी चीज को हॉस्पिटल में बना, please take some time to go into that bus and see what it does. उस बस के पहिए से लेकर बायोकेमिस्ट्री एनालाइजर तक उस बस में everything is feeding in. The entire mobile hospital setting up at this hospital is the biggest answer to this complex. It is not a thermometer. It is not a Fitbit band. It is a mobile laboratory integrated with high-tech machines. Biosafety cabinet 3 with HEPA filters on a Bharat bench chassis. The point I am trying to make is if you look at many other countries, innovation happens where knowledge is. Where is knowledge? Knowledge कहाँ है? देखिए मैन्युफैक्चरिंग फैक्ट्री में, प्रोडक्शन सेंटर में हम नॉलेज को टैप करते हैं, नॉलेज को ऐड नहीं करते। We exploit the knowledge. We don't add to the body of knowledge. We add to the body of knowledge in research institutes, where cutting-edge technology is researched upon by knowledge others, people who add to the body of knowledge. That has been the model universally, which is working. And then you take this knowledge, take it into factories, production centers, bring quality systems led by experts like Mr. Jory, add value, bring out error-free production.